Why is HER2-negative important for invasive lobular carcinoma? Invasive lobular carcinoma, or ILC, is a unique type of breast cancer that behaves differently from other forms. One key aspect of ILC is its HER2 status. Most ILC tumors, around 85 to 90%, are HER2-negative. This means they do not produce high levels of the HER2 protein, which is known to promote cancer growth in other breast cancer types. Understanding this status is crucial for several reasons. First, HER2-negative status influences treatment options. Since most ILC cases are HER2-negative, they typically do not respond to HER2-targeted therapies like trastuzumab. Instead, many of these tumors are hormone receptor positive, meaning they respond better to hormone therapies. This is important because it guides doctors in choosing the most effective treatment plans for patients. Second, the biology of HER2-negative ILC is distinct. Unlike HER2-positive cancers, which can be more aggressive, HER2-negative ILC often grows more slowly. However, it can still recur later, which is something that patients and doctors need to monitor closely. Recent research has introduced a subgroup called HER2-low ILC. This means that while these tumors are still considered HER2-negative, they have low levels of HER2 expression. This subgroup may respond differently to treatments and could benefit from new therapies targeting HER2, although this area is still being studied. In summary, knowing whether an ILC tumor is HER2-negative is essential. It helps define the tumor's biology, influences treatment choices, and impacts prognosis. This knowledge allows healthcare providers to tailor therapies to individual patients, aiming for the best possible outcomes. Understanding HER2 status is particularly important because ILC has different characteristics compared to more common types of breast cancer, like invasive ductal carcinoma. Therefore, HER2-negative status plays a key role in the diagnosis, treatment, and management of invasive lobular carcinoma.